my name is Sierra and I'm going to be your nurse today. We're going to be inserting a Foley catheter to help drain urine from your bladder. Do you have any questions? No? Okay, so we're going to insert the Foley catheter through your urethra and into your bladder, which will help get everything out. It's not going to feel amazing. It's going to be pretty uncomfortable, but it shouldn't be overly painful or anything like that. So if it is, you just need to let me know, or if anything is making you feel uncomfortable or like we should stop, you just need to communicate with me, make sure that everything is so we can work on any problems that we have together and try to figure it out. Okay? All right, so I'm just going to wash my hands, provide privacy. And then could you tell me your name and date of birth? I'm going to check your wristband. All right, Macy. So I'm just going to raise your bed so that the position is more ergonomic for me and so I'm not straining my back or anything. So to start with today, we're going to do perineal care. So we're going to get you all washed up in your genital area just to make sure that you're as clean as you can be for the procedure. And then we're going to get right to inserting the Foley catheter and getting that urine out, okay? Alrighty, so I'm going to put on my clean gloves. I've already washed my hands. And then I'm going to help you into your dorsal recumbent position. So that's just on your back with your legs splayed so I can access your genitals. And then I'm going to drape you just to help keep you feeling modest and like you're not all exposed and out into the open. Alrighty, let's pull that right over. Okay. So I have a basin of clean water with soap and I am just gonna get you cleaned up. Alright, so we'll pull that right down. And it's always best to clean from furthest to closest to you and then dirtiest to cleanest. So I would start just by cleansing the far side, front to back, changing my position, close to me, front to back, and then right down the middle. And then just once again to make sure everything is as clean as it can be. So far, front to back, close, front to back, and then straight down the middle, front to back. All right, so you are nice and squeaky clean. Just pull the drape right back up so you're nice and covered. And then I'll get rid of this. And I am going to toss my gloves and wash my hands. So at this point, I have my sterile gloves and my sterile kit. I'm going to want to check the expiration date on these, make sure that they're not expired. I'm also going to want to check the packaging, making sure there's no holes or the material doesn't seem like it's intact, because if there was any holes or anything like that, it would defeat the purpose of having a sterile field because it wouldn't be sterile anymore. So just making sure you're all set. Are you still feeling okay? All right, so at this point, I'm going to set up my sterile field and make sure everything's nice and dandy, and then we're going to insert the catheter, okay? Alrighty. So I have my sterile gloves and then my sterile field. So the outside of the sterile field, removing it from the package, is not sterile, so it's okay to touch this. Just placing it down onto the table. And then most people, I have a trash can by my feet, but most people also use the bag that it came in, just as a little trash receptacle to help collect little bits of trash as they go through the procedure. It's pretty beneficial, I think anyway. So you don't want to cross your sterile field or anything like that as you go through the procedure. So you open it farthest at the top away from you. Right, left, and then straight down. And there is a 1-inch margin around the outside of the sterile field. You can touch this area, but you can't touch anything else because at that point you'd be contaminating it. So you're okay to adjust and everything. Make sure you're not leaning over your sterile field. Just getting everything the way it needs to be. Alrighty. So at this point, it is okay for me to drape the patient with the bottom drape underneath, with just my clean hands, or so I would do that by pulling this out 1-inch margin, letting it fall, and at this point I would just drape. I would have the patient lift their hips and I would slide it under their buttocks if they were a person, but because this is a mannequin, they can't. But if I could do that, that's what I would do, but I just placed it over because that's all I can do with my accommodations. I would make sure everything's nice and set up. If I had a light available, I could adjust the light to make sure everything is nice and illuminated the way that I perceive that it needs to be. So at this point, it's going to be best, I need to put my sterile gloves on. So the outside of the package is not sterile, so I'm all set to open that all up with my clean hands, and same with the outside of the package. So I'm going to unfold this, set it flat on my working space, not crossing my sterile kit field, slide my fingers underneath the little handles on the package, and just make sure it's nice and wide open. So I'm going to start with my dominant hand first. So it's okay to grab the inside of the cuff of the dominant glove because you're going to be sliding your hand into the inside of the glove. So just do that, and then push your hand into it, pulling down over your wrist and then letting go. And then with your left non-dominant hand, if you're right-handed, you'll slide your fingers into the cuff of the left glove so you're not contaminating, and then you'll slide it over your hand like this, just making sure everything's nice and stretched, and then insert your hand into the glove, making sure you don't touch anything with your right hand, and then releasing the edge. So the inside of this package is still sterile, so it's okay to discard it into the trash. You don't want to touch anything at this point. I'm going to discard sterile gloves that came with the kit. I don't want to drop my hands below my waist or turn my back to my sterile field because that would contaminate or make my sterile field not valid anymore. So at this point my hands are sterile, so I can touch everything in the kit. So I'm going to do my fenestrated drape, which goes over the patient, and I will just drape that right over my hands, draping right onto the patient's with the hole. All right. So at this point, I can pick up the sterile kit, move it over to the field. I actually see that when I threw my glove package out, it kind of fell over the corner of my sterile field, so that actually contaminates it. So for the purposes of the video, I'm going to keep going, but I would have to start over. So I'm just recognizing that that happened. So I am going to move this out of the way, just so I can have a clear view for the video. So I would restart, I would get new equipment and everything like that and just start over if that was to happen in the clinical fields. So at this point, I have lubrication, betadine swabs, and a Foley straight cath, as well as a specimen cup. I'm going to discard the specimen cup because I do not need that. And then I'm going to slide the catheter through the hole. And then I'm going to lubricate, open the lubrication and lubricate the first 1 to 2 inches of the catheter and leave that. All right, so at this point, I'm going to cleanse the perineal area. So I'm going to make my hand dirty, so it's no longer sterile because I need to secure the labia and expose the meatus. In order to do that, I have to use my left hand. So this will be my contaminated left dirty hand, and this is my right, which is still sterile. So I would just pull back on the labia, exposing the meatus, and I would need to keep it that way. So once I've cleaned it with the betadine, I need to make sure that it does not slip back down over the catheter or anything like that, because at that point it would be contaminated and would need to get re-cleansed. So I will take my first betadine swab. So you're always going to clean furthest to closest and then dirtiest to cleanest, just to not bring any bacteria into the urethral opening. So I'm going to start farthest front to back. Don't cross the field, drop right into the trash. Front to back, closest to me. Don't cross the field, drop right in the trash. And then once again, front to back, right down the middle. Don't cross the field, right in the trash. So at this point, I no longer need my betadine tweezers, so I'm going to toss those out. And I can now remove the catheter, which has been lubricated. And the tip of my catheter, my straight cath, is in the bottom of the basin, which will collect the urine. So at this point, I'm going to insert the catheter into your urethra. So there's going to be some discomfort. I'm going to have you bear down until the discomfort subsides, okay? So at this point, I slide it into the meatus. If I were to accidentally go into the vagina, I would need to leave that cath in the vagina and then get a new kit and start again and try to get into the urethral opening. So I will insert that right into the urethra. You need to make sure that you don't touch the vaginal lips, your fingers, or the outside of the vagina or any sheets or anything, because that'll contaminate it. So I'm just going to insert this 2 to 3 inches until I see urine flow. If there's any resistance, I can twist it a little bit to help with the resistance, but I should never force it in. So if it's not going, then there might be a blockage or something like that, and I need to look into further reasons, but I should never force it. So once I see the urine trickle at 2 to 3 inches, I will insert it another 1 to 2 just to make sure that it's nice and in the bladder. And then I will continue to hold everything secure and let the urine continue to drain. Once it's complete, at that point no longer need to, I will remove the sterile cath and use global precautions. So I'll just, throw it away and everything like that the way it needs to be. So I'll just remove nice and quick, right out. And I won't discard the urine because a lot of the time you need to record the I&O, so when you document. So I won't do that. I'll save it and probably measure it and enter that information into the charting. So at this point, the patient has been cathed. I will clean them. I don't need to keep sterile fields anymore because everything's all set. So I will clean them all up, remove all of this, right into the trash, do perineal care, wash them down. I can remove the drape at this point, right back down. I can remove my gloves, do hand hygiene. All of this has been put in the trash at this point. And then I'll make sure that she's still comfortable. You still feeling comfortable? Are you feeling a lot better? Yeah? Okay, so you're not feeling any pain or anything like that? Nope. All right, so I'm just gonna make sure she has her call bell, and then I'm gonna place the bed into the lowest position. I'll document my findings once I leave the room and everything like that. And the differences between the female and the male catheterization is if the male is not circumcised, you would need to hold the penis and retract the foreskin, and using a circular motion with the betadine swabs, you start the meatus and work your way down about halfway down the shaft, and you just hold the penis secure. You need to use a 90-degree angle because that's the best way to get the catheter in, just to slide it in. You do need to lubricate more of the catheter for a male, 5 to 7 inches, because their urethra is much longer than a female's. So you will just lubricate the 5 to 7, insert it, and then you'll go about 7 to 9 inches into inserting into the bladder for it to actually reach the bladder, because it's just much longer than the females. Once you've gone 7 to 9 inches and it's in there, you start to see a urine trickle. Just continue to keep the penis secured, and go another 1 to 2 inches just to make sure it's all the way in the bladder and everything can get out. And then just, you know, do everything as you would. So remove using universal precautions, and discard, and, you know, document and everything like that. Make sure they're okay, cleaned up, and everything like that. So my patient is all set, and I've taken care of everything, washed up, and put them down into the lowest position and everything. They're nice and comfy. All right.